Hey guys, I'm here. I'm not sure if you were able to hear me in the last one. Hopefully you were. Um, so if you weren't, if you could post, and let me know how the sound is coming out on these. Because on my speaker here, it looks like I'm like totally blowing everything out. I don't know how to get that to stop, but like when I was listening to it again, uh, was super, super quiet. So gotta get a little close to the speaker, so hopefully you guys will be able to hear me. Um, I was last. Um, they had fixed my spinal headaches. I had been leaking spinal fluid for 4 days, and I had to go and have uh, the procedure done all over again in order for them to fix it. But they fixed it, and at least that pain was gone. We got the results back from the EEG, yeah, it's an EEG. We got the results back from the EEG from the doctor who, when I asked him if it was going to hurt, the test that he was going to do, because, I'm afraid of needles, and he said, yes, it's going to hurt you so bad, and, this is the most painful test, and I think he got a little frustrated when it didn't hurt me, and then again, when I wasn't able to do some of the things he wanted me to do, he, flex, but where I had no feeling from the waist down, it was kind of hard to, so we got the results back from that, and in his report, he said that I was very distracted, which I absolutely was. I had been leaking spinal fluid for 4 days and had a horrible headache. It was bad. So I was absolutely distracted. Absolutely. Sorry. Gotta move. So I had got the results back from that test, and it was the craziest thing in the world because in his results he didn't actually put results. He said that I was distracted, and that in his professional opinion that he believed that I had a psychological condition called convergence disorder. And what that means is that there's actually nothing wrong with you, but that you basically worked yourself up so much so that you think that there's something wrong. And so it's kind of funny because the treatment is actually the exact same for somebody who's got a convergence disorder versus somebody who actually has something going on. Is therapy and things like that until you are better. It's basically placebo almost. I would compare it to a placebo injury, where you're not really hurt, but you basically tricked yourself into thinking that there's something going on. Um, So, again, like I said, there were not many results. He said that the results came out normal. Everything came out normal. Um, but we found out later from a friend of ours that this test is highly, highly subjective. It's subjective to obviously the doctor's visual, observance of you, the way you behave, the way you act, obviously. Um, and it has a lot to do with that. So the other thing that I thought was kind of interesting was he never ever tested my back, like the nerves in my back. He tested up and down my legs, and but he never ever tested the area where my pain was coming from and where I believed I was having problems. And he says, well, and basically what I've been told about that is they don't do that because they know that there's something wrong there. They know that there's something wrong there. And yet I was then officially pretty much, diagnosed with this convergence disorder. Anyhow, so like I said, we had won our case, and so we were going to start seeing workman comp doctors. And I was just in so much pain. I could not, like I said, I could not even lay in bed and breathe without it being so agonizingly painful. They had me, and this was on very, very high doses of pain medication, and it was still unbearable, unbearable to even breathe. And then now on top of it, they're telling me that I'm crazy, and that so workman's comp. After getting the results back from this EEG, I think it's an EEG. I'm sorry, guys. I'm pretty sure it is. They decided that they wanted to send me for an independent medical evaluation. Now, what an independent medical evaluation is supposed to be, it's supposed to be independent medical evaluation, meaning somebody who has not seen me before is supposed to see you, make an evaluation of you, and evaluate how you are, where you are, and kind of what's wrong. They set an appointment up for me to have this medical evaluation. We found out later that the main point for these independent medical evaluations, and you can't say no to them. You can't say no to them. So workman's comp gets to send you to one of their doctors to evaluate where they think you are. And they decided to send me to the doctor who did the test, the EEG test. Now, thinking about it later, we should have never allowed that, and they should have never done that, because he had seen me previously, and not only had he seen me previously, but he had actually rendered a diagnosis. So the purpose and point of me going to have an independent medical evaluation from this doctor was basically the fact that they knew what this doctor's personal opinion of me was, and personal evaluation of me was that I had a psychological condition. And if I had a psychological condition, then they were and could no longer be held accountable, because they were being, I was being paid for my back injury and for the surgery that I had had on that, and so forth and so forth. So they sent me to this doctor again. They sent a big official letter saying, if you don't bring your records, if you don't bring your films, then we're going to charge you for another appointment, and, you could lose your benefits and all this fun stuff. And so I made sure to bring, the films. I brought the CT Milo-gram, that I had done, the results from that. And the results from that, the radiologist said that there was absolutely nothing wrong, that everything was fine, that everything looked pretty normal, was his evaluation there. And so, I'm just so frustrated, because it's like I have no idea what's going on, but I know my body, I know me, and so I go in, and workman's comp hasn't even sent my records from the other doctors over yet. And by this time, it had been a year, 2 years, going on, yeah, 2.5 years. I had seen a couple of other doctors, and so my packet was pretty big. And here I was a half an hour before my appointment, and this doctor wasn't even going to have the opportunity to look through my films. And so, he was sitting in his office, and I waited for my appointment time, and the nurse brought me back, had me change into a gown, one of their paper gowns. And, I was laying down, and my husband was in there. And the doctor came in, and he started doing these tests on me. The little hammer that they have where they kind of hit your knee, and you're supposed to have certain reflexes. And um, he asked me questions about my past, about my history, and so when he was doing the test, he was hitting my knee, and I guess I wasn't doing. Actually, I did not have much of a reaction at all, and sometimes I had an overreaction, an over reflex, a hyper reflex, I think it's called, and he hit me. He actually ended up hitting me so hard that I ended up with bruises on my knees, on my legs. Um, it was so bad. And then, when he was asking me, you know, um, I said, well, we've got films here, we've got records here. I was told to bring these. Would you like to see them? And he's like, no, 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 no. He says, you tell me what you think is wrong with you. And I looked at him and I said, I have no idea. All I know is I'm in extreme pain. I hurt even when I breathe. And I'm tired of not being able to walk. I want to be able to walk again. And he looked at me and he says, there is absolutely nothing wrong with you. You've got a psychological condition called convergence disorder, and you want to be in that wheelchair. Now, you've got it's not your fault, Kim, or Tatum, sorry. It's not your fault. It's not your fault. You've got no control over this. But there's absolutely nothing wrong with you, really. You've got a psychological condition. It's all in your head. There's nothing wrong with you. And I'm sitting here thinking to myself, this is crazy, because, yeah, what 28-year-old, 29-year-old doesn't want to be in a wheelchair, right? And, I'm sitting here going, this guy is crazy. He's smoking something because there's something wrong with me. I know me, I know my body. And I know that I would not be in a wheelchair if I did not have to be in a wheelchair. And so, he walks out of the office and I get dressed again. And that was the last I saw of him. We got his report a little while later, and it was so ridiculous, along with reiterating his previous diagnosis of a convergence disorder. He also put in there that, this is how ridiculous. Some people were so ridiculous, but this is how ridiculous this was. He put in there that I was poorly attired, he said. I was poorly attired. Now, I went in to this appointment. I think I was wearing like jeans and a long sleeve shirt. So it's not like I was wearing, they weren't even holy jeans, it's not like I was formally dressed for this appointment. But the doctor never ever saw me in what I was actually wearing. The doctor, when the nurse brought me into the room, the doctor was in his office, and then he went straight back into his office when I left. So the only thing that he ever saw me in was their paper gown. And if he didn't like the look of their paper gown, that's really not my fault. They need to change their paper gown. But he put in his report that I was poorly attired. So, More to come, man. Let me tell you, good stuff, interesting stuff coming up. So, you know what to do. And, subscribe. If you want to see these videos and hear the rest of my little sob story. But just so you guys know, I do have some really, really good things coming up. Unfortunately, we just kind of got to get the dirt out of the way before I can kind of tell you where I'm at and just how far I've come from where I've been. So, check it out.